EyitTV, empowering you.
Good evening, viewers. You're welcome to this program. The program is Health and Lifestyle. It is live on EyitTV and online TV. Today's topic is about false teeth. False teeth is a common thing we've had in the communities. It is loosely translated into Nyangore as evino, and this is a practice that takes place in rural communities mainly, and it is a very traumatic practice where untrained people dig up the gums of newly born babies to remove what they think is a false tooth, which sometimes they think it's a maggot in the jaw. So to understand what is this practice about, one needs to go back on how the anatomy of the teeth is directly from development. So I will take you briefly through this, and before I proceed, I think it is prudent to introduce myself. I'm Dr. Savino, a dentist at Smile Pan Dental Care in Mbarara City, and I want to take you through this briefly so that we can work together to prevent this bad practice which is happening on our children, affecting the whole population, making health unbelievable and lifestyle difficult. And hence our program is Health and Lifestyle. So how teeth develop? The development of teeth starts very early after conception, when fertilization takes place and life begins in the womb of the mother. Within the first 6 months, the first structure that form teeth come together, the primary teeth. Now that is as early as 1.5 months time. But at about 4 months in life, the tooth structure, all the structures that make up a tooth will have hardened within the jaw. So this tells you that teeth develop in the jaw before one is born. And that's where we shall understand where the practice of false teeth stems from, because it is very common in early days of infants, that is after birth, within 2 months, 3 months, 4 months. That's when really babies are suffering in rural communities at the hands of an trained personnel, thinking they are moving false teeth. To us in dentistry, there are no false teeth. These children have other problems, and these problems are misunderstood by the people in the community. But what happens? Children are born with what we call body resistance from their mothers. We have those proteins that remain on standby in our body to prevent and protect us against diseases. So at birth, babies are born with that resistance, with those proteins from their mothers. But as day passes by after birth, the proteins are being depleted in the body of the infant. So at 2 months, it is known that almost all the proteins that protect the baby against diseases that originated from the mother are depleted. So once they are depleted, at 2 months, the infant is struggling to develop his or her own body resistance. And so this infant at this stage is prone to simple infections. And at times, it's the time the infant is beginning to begin to sit up. And then is also interacting with the surroundings so much. So in rural communities, that's when they are sitting down. And they are able to touch down and put in the mouth. Touch unacceptable materials in the surrounding and touch in the mouth. And yet, this is the time when the baby has almost lost all the resistance from the mother. So this baby now can get any infection. We are in a malaria affected region of the world. So we live with malaria parasites. We are in the mosquitoes that are infected. So our children are prone to so many such transmissible diseases. So when they get any other infection, one of the signs they will get is fever. And here, once those children get fever, the mothers rush to the specialists in the community thinking it is false teeth. And the next thing, the mothers will check in the mouth of the infants, because for them they believe it is the false teeth that make children sick. Finish. They will not think of other problems as fast. So when they touch there, first of all, they will touch with unprotected hands. They introduce more infection in the mouth, and now that quite often will come with infections that are related with diarrhea. So you will find on top of fever, diarrhea also will set in. And because now this child is weakening, the other resistance from the mother is lost. There are more infections. The baby fails to feed. Now the baby fails to breastfeed. At this time now, all this confusion will now make the mothers and the experts in the community confirm that there is false teeth. And how do these specialists convince the mothers that the babies have false teeth? Because I told you teeth begin to develop as early as when life begins inside the mother's womb. So at birth, some teeth, like the canines, are very prominent in the jaw. And because of the other infection, fever, there is paleness of the gum. Now, the developing canines in the bone of the jaw can be seen prominent in the region through a very weak or hydrized gum, which means that hydrized gum is pale, and then the prominent points are seen. And when the specialists touch there, they will say, you see, this is where the first tooth is. And what do? They use their crooked instruments, they dig the jaw of the infant, and what they pick out will appear like a maggot-like, a very soft fractured tissue, and that tissue is actually a normal developing tooth, which they would have picked from the jaw. Others even they fail to pick it because they are not experts in anatomy, but they will injure it, and then they put anything else they can put and convince the mother that we have removed the false tooth. And now they will say, go and use penicillin, the false tooth is out, then your baby will be fine. So of course, now those other drugs will make an improvement in the life of the baby, but the mother is already convinced that it is because the other false tooth was removed. So there are no false teeth. It is a misconception. It is a misconception that must be stopped. It has caused a lot of things. One, the consequences are very many. First, the jaw, once it is traumatized, the jaw grows in line with existing teeth. Where a developing tooth has been removed, that area of the jaw will not develop at the same pace like the part of the jaw where the teeth are existent. So you will find in that region of the jaw, the bone is very narrow. That is already a deformity. Now, where a tooth has not been removed, you will find that early in childhood, the tooth will erupt but will be crooked. The form or the morphology, the shape of the tooth will be obliterated because of the injury caused by the so-called expert in false teeth extraction. So that already tooth is looking crooked and ugly in the mouth of the child. And at times it comes or it appears in the mouth and it fails its life. The tooth virtually dies, and then you see swelling of the jaw, and finally the tooth must be removed. So all that is bad life at the hand of a crooked practice or a crude practice of false teeth extraction. At times the consequences are grave. The infection worsens and the child dies. So also you lose life because of the crooked practice in the so-called false teeth removal. So At times you slide, finally grab, but when you are developing permanent teeth, you find in the practice the jam or the tooth jam that would develop into a primary tooth and that one into a permanent tooth were both removed. You find an individual is already missing teeth in the permanent life. You find the tooth did not appear because it was destroyed as early as childhood, and then finally you have missing teeth. So all this comes with an incompatible lifestyle, because either you look ugly or the rest of the teeth are crooked, they are misarranged because of the early practices where the gum was traumatized and the developing teeth disorganized. So all those consequences come with poor alignment of teeth in life, missing teeth in life, malformed teeth which will need to be reshaped and treated, at least to improve the appearance of the teeth. By and large, false teeth is something that does not exist, and I want to give you tips on how this should be handled. One, if you have a child who is sick, go to a health worker as soon as you detect any symptom. Let it be raised fever, let it be diarrhea, let it be failure to breastfeed normally. Go to a health worker, and the health worker will give you the right treatment after understanding the sickness of the child, and there will be nothing like losing teeth. Two, do not allow people in the community to be the first line experts at the hand of the life of your infant. Do not let them come and touch into the mouth of the infant. Maintain the hygiene of the infant as possible as you can. Another important tip is that do exclusive breastfeeding. I told you at 2 months the child is already compromised because it has lost the body resistance from the mother, but exclusive breastfeeding empowers this child to remain healthy and strong, and then interact with the environment and develop his or her own immunity that can protect the child against those possible infections in the community. So, quick and finally, ensure you have good health and good lifestyle. Maintain your teeth, maintain the health of the infants. Don't believe in false teeth. Go to the right health worker. Come to the dentist if you think it is false teeth. But normally the problems are general medical problems in infancy. The right doctor is a pediatrician. Where there is no pediatrician, see any nearby health worker in the community. With those few tips and that information, I wish you good health, good life. Watch EyitTV. It's an online TV. You can access it every Thursday at 5. The program runs, and please take these facts as very important, and take these facts to all those who don't have access to EyitTV, so that information goes beyond the border. Thank you for your viewership. Thank you for listening. Please take the message. Bye bye. Good evening, viewers. You're welcome to this program. The program